Hey TJ, so my name's Matt. You've come in today. You've come in. What sort of brought you in today?
So basically, I have this pain on the outside of my right ankle,
Yeah.
and that's why I wanted to come see you today.
Oh, okay. So I just want to ask you a few questions about your ankle.
Mm-hmm.
Everything you tell me is confidential.
Mm-hmm.
I won't tell anyone else about it.
Mm-hmm.
And if I wanted to do that, I'll get your explicit consent for it.
Sure.
So you cool if you do that?
Yeah, man. Go
All
for it.
right. So you say it started in your you got pain in your right ankle.
Mm-hmm.
What sort of like how would you describe that kind of pain in there?
It almost feels like the ankle just wants to give way.
Yeah.
Like it just feels unstable, and
Mhm.
when it first happened, it was just really sharp.
Yeah. Yeah.
That's how I describe it.
And what kind of like intensity would you say when you injured it? How bad was that pain out of 10? If like 10 was like the worst pain and like
Oh.
1 was like
It was hectic. Like I would say 10 out of 10 when I first injured it.
yeah.
Yeah.
Real bad. All right. And what about like when you're just using it now? Like since you've been injured, when you're just using it, how
When
bad
I'm
would you
using the
say?
ankle, I'd say it's about 8 out of 10, so it's still up there.
Out of 10, and like just like maybe just standing around, is it still an 8 out of 10?
When I'm standing around, usually if I'm walking around or standing,
Standing.
I'd say about a little bit
A
less,
little bit less.
usually about 7.
About 7?
Yeah.
Okay. What about when it's not being used, like you're sitting down or you
It's
in bed?
there. It's kind of like this weird, like, achy feeling, right? So it's about 5 out of 10, I'd say.
Yeah,
About
yeah.
there.
Okay, for sure. And is there any pain from that spot that's referring like away from it? Maybe up your
Uh,
leg or down into your toes?
no referral. It doesn't seem to be going anywhere else. It just feels like a really strong pain
Okay.
just at that one place.
Yeah, for sure. And you said how long ago did it sort of come on, and how did it sort of go from there?
So it happened about like roughly 10 days ago, and it kind of started with me playing a basketball game. So
Yeah.
I landed wrong, and when I was playing in the basketball game, I wasn't really paying attention. I was too busy reaching up for the ball and fighting off the competitors.
Yeah.
So I basically landed with, I don't know, it just landed funny and just rolled on the outside of my ankle.
Yeah.
That's kind of how it started.
Did what sort of like part of like your foot did you was your foot like your toes pointing down
Yeah.
or was how was it when you landed? Do you remember any of the
I think
specifics?
if I was to pick specifics, I'd say I'd probably landed on my toes. I don't remember my heel hitting the ground.
Yeah.
I just remember feeling a really sharp pain on the outside of my ankle.
Yeah,
So I'd say it was just straight up on the toes and then just twisted out.
Okay. And like if you had to get a bit more specific, like pointing towards it, where would you say like the swelling and like all the pain and like the sensitivity around that ankle is?
I'd say it's majority of it. It's like on the right hand side of that ankle, so it's just on the outside right here.
Yep.
And I'd say like where that bone is on the side.
Yeah.
It's really sensitive to
that
touch
bone.
that.
Yeah.
On the outside of my ankle. It generally just feels really unstable, and it doesn't feel very good to balance on either.
Yeah. And so since then, how has it sort of progressed from that first day you did it to how we are now?
So when I first injured it, I could barely move it. Like I could barely even put any weight on it. It was that painful.
Yeah.
And I had a lot of bruising and swelling for the first 4 or 5 days.
Yeah.
It's settled a little bit now, and
Mhm.
I've started putting a bit more weight on it. About 3 days ago, I started putting a bit more weight on the ankle.
Yeah.
I'm still walking with a mild limp here and there, as I'm fearful of putting too much weight.
Yep.
But swelling is definitely reduced since the first day, and so is the pain at rest. Initially, it was just painful all the time, but now it's definitely reduced when I'm resting it.
Yep.
But when I move the ankle or use it, the pain's roughly about the same.
How about like when you're trying to jog and
Yeah, it
that kind of
definitely
stuff?
aches. Yeah,
Definitely
it
aches. Yeah.
definitely aches then.
Um, all right. Well, what kind of things have been aggravating it? Is there anything that makes it worse?
Yeah, well, I work at a sports store, so
Okay,
I'm standing on my feet all day at work or walking around, so that usually aggravates it, being
Yeah.
at work.
that would do it.
And I'm a big sneakerhead. Playing ball, you gotta be a sneakerhead as well.
man.
So
You're a Jordan man, or you're
definitely a Jordan man,
Jordan
but I
man?
prefer the Kobe's.
prefer the Kobe's? Yeah,
I
me too,
prefer
bro.
Kobe's. Something about the low cut. I
Yeah,
prefer it.
yeah.
But usually wearing shoes with like a thick sole or a high sort of back sole and then
Yeah,
thin
yeah,
in the
yeah.
front. That
Yeah.
usually gives me more problems. So I haven't been able to wear them as much.
Yeah.
It's killing me really.
Yeah, damn.
But doing anything physical, like jogging, running, sprinting, jumping, balancing, that doesn't feel good at all.
Yeah.
Even walking around university or driving, sometimes when I'm driving as well, I can
Yeah.
feel that.
Oh yeah.
And yeah, that's pretty much it. Oh, and the other time I remember it hurting was when I injured it. There was a sports trainer. We have a sports trainer at the club.
Yeah.
And he was the one that sort of helped give me some recommendations as far as
Okay.
what to do with it.
Good.
But when he moved the ankle in certain positions, that's where it hurt then.
Yeah, yeah, yeah.
When
For
he
sure.
tried to sort of recreate the injury. Definitely.
Yeah, yeah, yeah. Okay, for sure. And is there anything that you've tried that's helped like get rid of the pain, relieved it a bit?
So the sports trainer gave me RICE, so rest,
Yeah.
ice, compression, elevation.
Yeah.
That's probably the only thing that's really helped.
Okay, awesome.
And
Yeah, yeah.
It's helped to a certain extent.
To extent. Yeah, yeah, yeah. All right. And what about? Is there anything that you've tried that hasn't really done anything?
Nothing at the moment that I've taken notice of.
Okay. Yeah, for sure. So you've rolled your right ankle, or we suspect.
Mhm.
Have you ever had any like ankle issues in the past, or
Yeah.
anything like sort of up into your knee and your hip?
Nothing with the knee and the hip, but in the past, I mean, I used to play sports as a kid as well, so I used to roll my
Okay.
ankles all the time. I
Yeah.
roll both sides. In
It's
the
a killer
past.
sport, man. Basketball.
It is.
Yeah.
And I mean, aside from that, nothing really. But it's never been this sore for this long. Usually within a week, it's resolved. But
Yeah, right.
It's about 10 days and it's still sore.
Okay. Have you ever had like treatment for it in the past?
Yeah, just what the sports trainer gave me, just
Yeah.
giving me the rest, ice, compression, elevation stuff. That really helped out to a certain extent again.
Any exercises or that
Yeah,
kind of
he
stuff?
actually recommended some movement exercises. He was
Yeah.
just like, just moving the ankle around will help some of the blood flow. That's what he said.
Okay. Yeah.
And he said it just helped with sort of draining some of the swelling out as well.
Did you ever get any like imaging done, like suspect a break?
No,
Or,
I
kind
don't
of
really
stuff?
see that many doctors or anything.
Okay.
I didn't even see doctors for that. So
yeah.
I'm just kind of home treating it. So I haven't
Yeah.
got any.
No, that's perfectly normal, man. All right. I just want to also ask you some just other questions about like medication, surgery, that kind of stuff. Can be relevant. So, are you taking any medication at the moment?
Just basic supplements like multivitamins, fish oil, bit of whey
Yeah.
protein. That's about it.
Yeah. All right. Awesome. And any recent or injuries or traumas or accidents?
Aside from rolling my ankles when I was younger, nothing.
Nothing.
Major.
All right. Surgery?
No
No surgeries. Major illnesses?
No injury.
Family history. Does any of your family have like any diseases? Anything, heart conditions, that kind of stuff. Anything that could run genetically in the family?
As far as I'm aware of, no.
No?
We're pretty
Okay.
healthy.
Awesome. I'm just going to also ask you some questions about different systems in your body.
Mhm.
They might not seem really relevant to your ankle,
Mhm.
but they're important and they can show some like red flags that we might just need to pick up on.
Sure.
Is that all right?
Yeah.
All right. So, have you had any sort of problems with, weight changes or nausea, vomiting, or change in bowel movements recently?
No, nothing.
Nothing like
untoward. No.
Any chest pain, dizziness, or shortness of breath? No. Any respiratory problems like night sweats or hard to breathe, that kind of stuff?
No.
No. All right. Any kind of change in like going to the toilet, anything like that, urinary function?
Nope. All sweet so far.
All sweet. All right. Great. Any issues with reproductive organs or anything
No.
should be aware of? No.
Thank
All
you.
right. That's good. Endocrine. So like changes in like hair, skin, or nails. Like sort of unexplained sweating or fatigue. Anything like that?
No.
No.
Pretty normal.
Have you had any faints or seizures or like blurred vision and speech?
No.
No. Any dental operations or things going on there that I should be aware of? How would you say your diet is?
Diet's pretty healthy.
Yeah.
And I eat my meat and veggies.
Yeah,
Meat
you
mostly.
get 5 veggies and 2 fruit a day?
I wouldn't necessarily say 5 veggies, 2 fruit, but I definitely eat vegetables a lot.
Okay, that's good,
Like
man.
I eat like a lot of fermented food and stuff like that. So,
Oh, okay. Yeah.
And then usually on the weekends, I mean, just hanging out with friends. So my go for a drink or something like that. Or
Yeah.
I don't mind a joint once in a while. That's probably the only time I eat bad food.
Yeah.
Munchies, and
Yeah.
That's about it.
Oh yeah. And how would you say like your sort of quality of life is at the moment? Like you got a lot going on.
Yeah,
If you
I've got a pretty busy schedule, but I
yeah
make time for the things I enjoy. Like, I mean, I'm studying full time at uni.
Yep.
I work at Rebel Sport as well, casually.
Okay. Nice.
So that's kind of some money on the weekends, sort of thing. And my, aside from that, I'm just spending my time playing ball or I play video games.
Yeah. That's
Just hang out.
yeah. Hang out, man.
Yeah.
I feel it. That's nice. So like if you had to rate your quality of life, like 5 being like really good and like 1 or 0 being like no good, where would you rate it?
I'd give it a solid 4.5.
4.5. Yeah,
Yeah.
awesome. So that's that. You're feeling pretty good about life.
Yeah.
Hey, so that's all the questions I wanted to ask you. Is there
Alright.
anything that you think I missed that you wanted to go over?
Nope.
No?
I think that's pretty much.
All right,
very
perfect.
well.
Well, we'll then move on to the next part of the treatment. Get you up on the table and get some diagnosis going.
Beautiful.
All right, sweet.
Nice meeting you, man.
Done.